Oteseconazole 150 mg capsule is used to decrease the chance of recurring vaginal yeast infections, RVVC. It does this by preventing the growth of common types of vaginal yeast, fungus. This medication falls under the category of azole antifungals. It is recommended to take one 150 mg capsule orally once a day, with or without food. It is best to take this medication at the same time each day to maintain a consistent level in your body. When taking Oteseconazole 150 mg capsule, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with food as directed by your doctor. Swallow the capsules whole and do not crush, chew, dissolve, or open them. The dosage and treatment schedule are based on whether this medication has been prescribed to be taken alone or with another antifungal medication, fluconazole. If taken alone, it is usually taken for 2 days in a row, and then once a week for 11 weeks. If taken with fluconazole, take fluconazole as directed by your doctor and then start taking oteseconazole after day 14. Take it every day for 7 days, then once a week for 11 weeks starting on day 28. Remember to mark your calendar with reminders when to take your medication. If you develop symptoms of a vaginal yeast infection, be sure to inform your doctor. If you experience headache or nausea while taking Oteseconazole 150 mg capsule, it's important to let your doctor or pharmacist know. However, many people do not have serious side effects while using this medication. While allergic reactions to this drug are rare, it's essential to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or you can report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects, or you can report side effects to Health Canada. Before taking Oteseconazole, it's important to let your doctor know if you have any allergies, as this medication may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have kidney or liver disease. If you are planning to have surgery, make sure to inform your doctor about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. It's crucial to avoid using Oteseconazole if you are pregnant, planning to become pregnant, or able to become pregnant, as it may harm an unborn baby. If you become pregnant while using Oteseconazole, notify your doctor immediately. Additionally, it's unknown whether this medication passes into breast milk, so it's recommended to consult your doctor before breastfeeding while using this drug. When taking Oteseconazole 150 mg capsule, it's important to be aware of potential interactions with other medications. These interactions could affect how well your medications work or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's essential to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Oteseconazole 150 mg capsule. If you suspect an overdose or experience severe symptoms such as passing out or difficulty breathing, seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach the local poison control center at 1-800-222-1222, and Canadian residents can call a provincial poison control center. This medication is used to treat certain fungal infections such as yeast infections in the vagina. Oteseconazole belongs to a class of drugs known as azole antifungals. It works by stopping the growth of the fungus. For best results, take this medication at the same time each day. It is important to continue taking this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Remember to take each dose of Oteseconazole 150 mg capsule as directed by your doctor. If you happen to miss a dose, make sure to speak to your doctor or pharmacist to figure out the best way to continue your dosing schedule. When it comes to storing Oteseconazole 150 mg capsule, it's important to keep it at room temperature and away from light and moisture. Be sure to store it in a place that's not in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of this medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're unsure about the best way to do this, be sure to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.